Obi, my ancestry or my Yo, Yama, Ebusafo Akwaba, ye kobo, ye ni akonhoma, ewo Achima Agogo. Say normal, you could hear Nadia Efe. Mijidi say, Sene, Timemufodi or Monsem Atujano, and Penifonso, Ebiti na Supemna, Mobile Hono, ye de Akoma or Mona, Yina, Hon Atoyem. Yegusua, ye didn't come on Pabusu, or Garden City TV. And Rason say, Anopabusu egugu ewo apomodin eso na Yuniaba Gloria Antonia Amwaten Ajiman, Director of Communications Advocacy for Medical Malpractice Victims. Ewo Hasia obeboye na afi yahwe yeko ayaresabia se yeko akopa ayaresha enoma ya na yitimi ekunya no kra no echen se de de koye no obekoro na ibie na uwu kra na yeba beto ana se iprebi na akwakofa ene we brina na ya na itimituen ibia na obi anye na dwuma yi omo mo hweye no na doctor fo nurse fo ne omo ye dwuma ya resabia ho no obi anye na dwuma yi a itimi de oha kese pa ebreyen na ya na yen bibrim hase Ghana hase no fama nyame enya hwe yenkrabia sara nyame ahye no ebia na eno a na de obekọ wuo mu ebisa na nya sa nyame hye no nipa boni ni bia na nipa bi mfum so bi oye no na de sa oha no abro se ebasa fama nyame no advocacy force there be esa emwa oman no na yepese ekoye nim de na o se etimi tu ho anamo nti eno na omugusu a wo mo kyerɛkyerɛ Ghana for se na be ya yebi hu ne ye na nyina ye na aboa ye nti anopai ye hwɛ clinical laboratory errors ai kuko ayaresabia labs no edimu akotene papa yenko hwɛ mu gyemu yenhwɛ wo wedie num ne hu ne ha ansa ne ama waduro ti se hwehwɛmu na ankoyi a ebetimi de ha bebrina aba anopai yenu aba Gloria ha se obeboy na yate ensem we say ase Gloria memo achen
Nya.
Impom to say.
Osro adom ye ho ye.
E de nyame ase. Ya bin sha say odo ho abo afode na ubie Ghana fo ani.
Amen.
Na fa nyame no so so ye njai.
Nne njai. Mesi ba bia o meka o mesi minya Kristoni. Asantisa.
O hayi nyame som.
Ana
o boaye mum.
Me boaye.
O boaye.
Me boaye nyina ho because Bible say nimdi a me mindful nim enti. Of course say mo no mo yo. Enti no e wo say nipa nya nimdie. Na nimdie no empower yen. Na yetu anomo aye djuma. Enti we Christo sumpa, we gospel pa. E wo say unya nimdie. Enti anope da
Bible grounds aka say bibie mo ye hwehwe bibia yempe nimdie ne ntiase. Enu mo na betimi aboa ye.
Enti no nya Christo sumu ano. Enti me hwe ase. Gina na. Yeda shofo asepa no place so yeda GCR TV so ase say yenya asa kwanye madaruma na yitimi ene church yesua de bebre kakra na hospital manasa yare sabia kese esi ho no afa bebre wom ene ma obi ayarehwe edimo nurse for ho doctors wo ho midwives wo ho pharmacists wo ho ancillary workers simple one medicine mun won need direct but accountants wo ho orderlies wo ho an entire hospital facility no dwumadi bebre na efa bi sa te say laboratory setup very very important enso eka ho enti enfomso etimi ba se ne yaka pharmacists yaka nurses yaka midwives enfomso timi ba lab dwumadi nim na enfomso be ne timi ba into bi betimi aka se we die it's me a basics for medical malpractice. Mami ni kan enka se ayare wayare hwe nyina mu no 70% of medical diagnosis ejina laboratories ehwehwemu so.
Very true.
Because doctor no ebe hu se ti ya oya ana se o anemia ana se bibise na ye wo no mpempi no also yen hwehwemu. Hwehwemu no nearly 70% ejina lab so. Enti hwehwemu be ye mojamu hwehwemu kwame yɛyɛ dwonso mu nhwehwɛmu sɛbi yɛyɛ agyanan mu nhwehwɛmu deɛ keka ho bebree enti no ansa na doctor betimi aka sɛ yawie wei na ɛyɛ wɔ no nhwehwɛmu bebree na nearly 70% ɛyɛ yɛnuanom ɛwɔ lab yi adwuma enti sɛ mfomso kɔ hɔ a na asɛm aba ɛna wɔn nnwuma no so no technology nti ɛsesa sɛnea na mmerɛ bi atwam yɛhwehwɛ mogya mu no ɛnɛ yɛhwehwɛ mogya mu saa sɛnea yɛtwe no koraa ɛyi bebree aba technology bebree aba ɛsonson ɛdane enti ɛwɔ sɛ nim oyɛ nimdefoɔ paa one ɔmo lab techs no even attorneys lawyer ni a ɔwɔ koraa pɛ sɛ odi asɛm nhwehwɛ mu sometimes you should know how these technologies are because it changes over time.
Not necessarily say obekwa kusua adwuma no.
Debi.
But obesua
but also who senia wi a omo nnwuma site se na be yamfom so bi ba ya ye betimi a chew mama wate ase hu se ampa because technologies be bre esesa enti ede na betimi ama obi aka se mfomso aba ana error bi aba eye lab technicians yi afa omo ankasa chichemu miensa mfomso a eba ewo de di kan mo frɛ no pre-analytical stage ɛhɔ no yɛ sɛ ya kyerɛ sɛ kɔyɛ sɛ bi dwunso mu nhwehwɛmu bi ana sɛ kɔyɛ sɛ bi agyanan mu nhwehwɛmu ana mogya mu nhwehwɛmu mogya na bi a yɛ hwehwɛ 1 2 3 enti ɛyɛ before a nhwehwɛmu na ankasa bɛkɔ so no ɔmo ankasa akyechem mfomso timi kɔ so wɔ hɔ ɛna analytical stage na ankasa yɛ place a nhwehwɛmu no ɛkɔ so na ankasa the second stage no and then the third one a post analytical stage the edi kan no any the twa to no mfomso na ɛwɔ hɔ no so pa
so
ai ye take pre analytical stage no any ɔhwehwɛ the edi fifi no analysis na ankasa ɔmo yɛ no hɔ deɛ ɔmo ntan nyɛ mfomso
ɔmo yɛ test na wie no
enti before test no during test na ankasa and after test
okay
mfomso no ba sa stages mean say na before test no any after test no mfomso no ta so chain test na ankasa
no testimony madam Fubina ne ba yare na no omo ye test sa just test hu hia no mo ye
oh
that prayer you know na offering adam for doctor bi doctor ne ba ya no say no obi say no symptoms ne na keka no say no yade we na e oba na quickly a test aka so nyanyina o mu jaye na ode ne call confirm no chia na me ada roma akwada na yetimi ase even in life enye doctor na nka ba mu a
okay
ka madam for no hwere ne ba no enti sa pray ho no unya fa me nwura mu de but me sure say
order the ordering of the samples the specimen ne ade no mfomso bebree timi ba ho omo bo ono ma wo so omo report case bi agent ana ebi critical se sancho na ma mfomso timi ba but me yenkom most errors like I said they cause the pre-analytical stage and the post the analysis themselves stage you know e cause the badenye kese I am not omutai nimdefo biomedical scientists no omutai omuye nimdefo they know I'm not saying say others are not there in the hono the na technologies no use nti no onim hono informs we ba na ta form analysis of the specimen our fa no say bi Johnson no ankasa nhwehwemu no hon the na omunim nti ya na mfomso no form but the decan nti yenhwe bibia ye friend no mislabeling of a specimen. Enti yakoje wo Johnson wajana ana umuja but ensure ye try to so no a label no wrongly and from so kese pa because then it means that ye ready ye de kohen ye nya sample na we but the way I label no wrong enti no ya either say antro din ni and I say specimen na nkasa no ya antro ni ye enti who handles what where is it going a lot and as long as you are mislabeled it means we have to discard it because you label you nya label ni and choye na e so bia osumesi obenten abc moja we sample we ni afa and adwunso we ni afa yɛantwerɛ no yie ɛnti ntumi nyɛ ho adwuma yie mfomso kɛseɛ paa either say you might have to go and take another sample and also obey wrong work on it. Number one. Number two, a collection of blood in the wrong type of tubes. Also, much moja na ewo ebia ni baby anya moja baby ani edigu. Omo tubes ahodo bebre sa enyo nketenketa se enkoto entoantoa nketenketi bi aya omo etwetwetwegu mu no. Esune bia ne eye wo se gum. Enti no oko collect blood for example now the good the wrong tube mu a. Eno so wa ha adwene.
So ye kasefa ojonso bra you
ade
a ede be ma
moja so
e wone de
sebi ejanan e wone de sometimes ibi ono a wohnim wo intesio kra ni nyina wone de enti no you don't collect, you just don't go and collect because you say collect specimen we ofiti na okoji bibia na de gutu abia mu ye wo to abia ne de wo se de kum enti say omo de good wrong eto mu a you benya wrong ade so enti and say you collected the wrong blood for the wrong tube.
Okay,
it must be in the right tube or container. And yes I from so aba. Number 3, specimen na ya collect no kwa me ayera enti yaje esiedu edwonso ayera yehu no bi adwonso nafa
so ne no ase for bra
say unim say bibi ze adwonso sometimes this all ma ho emreso and as this all shame enum nsuo bebre bi
especially open kwada de a difficult den so binya
kwada de e na so ayera say timeliness bi ne yedi ye adwum yedi doctor ne pese ohu result now or jo ana ohu treatment process obe start na say eyemre bi na also de ya what delay why ira de na say what delay
wakai me da bia na me na fufu bi wakai me na wadafu bi so de time asem ya okay very very important na ayawo enti doctor ni hia be ma no hu nsuo and it's a timely. It's no say or friend Irena Omoko doctor no office now.
When I pay crime before
now we will Breno Kunyana so Koirana.
Better as I baby. This is how the starting process you know so move. Eti we sample our hard. Aye, what hard because if one my timeliness be I was saying treatment be starting. Yenya diagnosis no TNT started this a train kakra and san yenya anabisa and sometimes kwa no so mutimi ka che say if you are no papa wo junso and no mo pe say hanti ana eye mremre so omo nyim de omo
hwehwe obi nso koye DNA test omo kire no timer onfa saa ayi no ade na ode be fifa na nemu test no kire no timer on sorry na onfa sa sample nemra ti bibi say no de bana okoira na wa hadwen
enti losing of specimen number 1 and e bi so on ma specimen bi on ma a delay enti losing of it is wrong and a delayed receipt of a specimen
okay
e was saying ka wo so de bantam na wo so one farmer also crowd be contributed to the errors. But what I say, and you know, yes, also so far, Jones or Bra, so time ya yaking. Now the we are the neighbor. And also, and I say, Puano Padiano, 1 minute, 2 hours after. And so I
say,
don't worry, probably, and also might be contributing to errors, Nibi. You know, it is a career, more practice, and I will you could be a contributory factor to it and don't and contribute unknowingly doctor say fa junso we bra embrace
nonsia na
de and so because sorry nonsia na junso sorry nonsia na junso me first specimen no because so delay e could do omo ho no ma bia na de omo hwehwe no omo enya and no delayed receipt of specimen and I be so one man was say refrigerator
na ya chef fridge
specimen bo ma say the chef fridge na ya am fine chef fridge okono okako ye nhwehwemu na analysis no so onya de open.
Yeah.
Because you were supposed to have refrigerated a certain specimen. Why?
Typical example, yeah, COVID-19. Unse bi drone credit way no baby o here
say. Ana she yibim kama.
Omo take sample na so de she bibi mu. The way I preserve ade no.
Yeah.
Ti say one na.
Untimi enye just say I was all refrigerated ade now am refrigerated and as on say ana be vaccines I no more special ade a omo di hihiem. Aha, nye bibi an sure ntam bag popotwo bia mu ana bibi sa do. Nti no I was all refrigerating. One refrigerator ye nya correct diagnosis na happen analysis now it might be tampered with and it might change. So could be some of the errors by be so hono on say your fridge and your freezer. It be so hono it's not supposed to be frozen.
Yeah.
But now one man freeze it. And also can result in errors. Samples this specimen na almost taking in no e bia wo de wo say say o mese o switch o be cause havoc o be na wrong you can say analysis specimen be must not be frozen and say so the question freezer I will say chef fridge but a certain temperature no why any sir if it's not supposed to be frozen now freezing now and also so you can get errors and then e bia na o log in specimen okay meje no time you say ma log in but the question o log in incorrectly and as on log in cry of the specimen they have processes they have procedures they follow
no protocols no
enti waji moja ako take sample we also log in if you don't log in ebia na we also the oba next ni ye ho adwuma ana bibia ana we ye ho adwuma do baby also beto aso one log in so they can work on it ana bibisa they can either delay results or diagnosis and or analysis or not be done at all and also so now I'm more patient and the MD betwa eto say o collect specimen from the wrong patient until say meje ojonso na ebia meje obi entesio and I say bia covid na swap ya ebi one ma nose no na yadura ohunim ana bibi enti we collected the wrong sample ya nka say kotwe na je Kwame Johnson but ebia ka say swab ni bi ebia nanum now say Kwame Johnson na family a wrong collection of specimen for the patient there na woko hwehwe enye no na woko hwehwe enti no ana usually kwa omuso so no mo pede ya tra ma no a wo de ba. What is the doctor ordering for? What are they looking for? Ojonso test you be a fluid be from your nose and BB whatever they are looking for. Moja na was watching. Also moja na yetwi be sometimes with time it depends on what they are looking for. But so or collected the wrong sample from the wrong patient and so no whatever you analyze or the bar and you're not doctor no Ebi ne say na the way lab errors but aboche case here by na ye citing the last time you could try 9 right you could try left. And so if you collect the wrong samples and no more patient no treatment no in any way. So these are some of the errors that affect diagnosis or analysis of a patient specimen. Subsequently, I know and sometimes during the post post ni can be you can say or analysis ni be or chrono now what wrongly and our interpretation of it na acquire wrong so those are some but the main analysis in Finfini they get it right most of the time they get it right so analyzing sample no eye ho adwuma Johnson now G Moja now J and all your juma. But
also most at times I love it because
some can get there's a percentage of
African lady or 9. So I'm analysis in your chest be 7 and 8. But now me who back on so analysis stage.
But I no lab for juma scans no. If they missed it
and that scan so or bet me call say more practice for
they can because everyone man na was say ohun ade bi and an interpretation of ade na ohun ye no it can But I know sometimes they have a leeway because just one man calling one man no man did that be so.
Technology in any machine, but maybe me a detective.
Anyway, well, it might not be an excuse, but we are saying, say, omo jumano as lab techs. In fact, say Nedika aka for dear, and in the whole here, nim dear omo dear jumano here, because omo results from so come and my patients need treatment now. Prolonged or delayed unnecessarily or never treated at all. And so be the patient na asemba so there medical malpractice advocacy for medical malpractice victims. You be to nice so ashishim.
Mbe grab no see.
You touch.
But when you know better na patient ne who say ahana from so ne wo. Say from so na buy na dey how brain no. A lab hono or ena omu yes
on say be medical malpractice you free results no you free end stage no na ya basro every time no yen boba patient you might not necessarily know and be able to interpret it. Sometimes if you call the doctor might see say no, this is not what I requested for, and I say bia madam pacho say they might, some may not tell you. But say when you come to us, sometimes we go from the end way, you know. So we always come, okay, let's go back to process, no. Then if we have call her, to see na errors, no, free. Na any na ye de afa baby, or say ye defa. Nancy be or say de bano. Correction bill, restoration bill, near the amounts and make us say medical malpractice, mano. Nipa no some of the resulting if compensation and damages are yedema patient no a compensation a negotiation a restoration. I mean all of this are in the legal I can't say ambits. Enti ebi wanoma from so naba e pranaba yedi echa ne ko hu bia from so ne free buy na nipa nanya compensation. Can some come in cash? If you saw on my hospital and our facility can say you better restore. And you better a correct error now a buy you know. Until one ma over coffee you and I say be surgery be now mobile correct the damage and the error now or mobile disusa maybe so on my negotiation yet take yet tenacity na ya can seminal baby beka kusibia and I say court of law. Then we pronounce, the court will determine and pronounce whatever they will pronounce.
Maba say Dr. for Ghana and your mejume yintina mo pese mo be how mo anase mo botaye pa mo de sa ejuma wi na ba no and
in fact doctors nurses you know mo ye ejuma wo so maka cho me tie say me doctor me nurse ni me lab tech me midwife enti ene omo na ye ejuma no. They are part of the team, and from so be bad, they are able to tell us to say, my colleague we know for me, they are able to tell us, they are able to pinpoint the errors to us, and some the chair process. It's in the idea, I must say, how we are, but you per se help a sanitizing system, because people are dying, and the word is needlessly, because of any dahobia ama on the part of your medical practitioners, they are the people with the requisite skills and the knowledge. They are the professionals. So we are okay. I read in the coin. We didn't go fit them because we him say fit in we and no crown fit in. On say oh the oye Volvo, the oye Benz, the oye. Those are the specialties they use. And the one who have a couple say we only fit any papa. Ne juma na nko yi. Wa mesi bibi anase ni nim dia won hono wo form. So we want to help. Yent me eradicate malpractice cry. But tibetimi ama brase. Yeah, pinpoint. We are speaking up. Yeah, church for not so call hospital. My any da ho. Be many questions. Our right, our responsibilities. Yen na ya afemu die no na pomodin koso. Na nipa nya nkwa. Kwa me abusua bi agija because breadwinner of the family no. Ya render no disabled and I say like incapacitated. You try nti on come abium. Ebusua bi abo ase akola bi school abono because ebia the ohwe no wawu because of medical malpractice medical negligence. And here, dear, you must say,
how never knows go in free mu.
Unlike
advanced countries, I was reading about I think the governor of Texas. He's physically challenged, disabled, or to reach him. Nasika every month be our watching because of medical negligence, the cause the disability, but the states, I was actually saying, every month be a sika it and I know they heard the bush rising to become governor
okay. So
Bahanka or Famanyame.
Say no nanti once make na abusu agija akola bi school abono what I say abusu I don't know sometimes the breadwinner is even dead.
Yeah.
It's your church say yenya ni da ho we should be we should not be distracted as medical practitioners. Enfom so de obeka say onipa ho e bi so onom ko me enfom so but na enja upra. It can be quickly corrected and resulting in an injury. E bi so onom a na an injury and death ban beba and no more. Not every injury or death is caused by malpractice.
All right.
And no they yen clarify no.
Gloria for number no etuja say obi ewo problems are no person obi hu a obetimi afre.
Me pacho advocacy for medical malpractice victims which I TI friend AMMV no. Ya share ewo Ghana fa na nyina. Ye adwuma ba bia but make say ya wo hwe me okomase. Enti ubetimi ebo ewura latest form dina ewo ahojo runabout ho no eho na yaso ewo your number 0500213232 0500213232 0500213232 ofre say number na bebia wo bia wo hwe me ye befa eje ofeso etie wasem se na etie ye betimi adi asem na chi a be ye hwehwe mu e beka kyo e asem a yentimi ni achi a ye beka kyo ye de honesty and integrity na ye adwuma enti friend na ye moa ebia na doctor no anase error na cause one wo de na abawie but ye betimi aye ho bibi amaw anase ebia betimi ape compensation bi amaw and ye be restore whatever the case is, especially if it's within 1 and then 3 years.
Okay. Yo, Gloria Antonia Amwatin Adjaman, EDACP, we're Director of Communications, AMMV. And one Abidin Komo, Abibi Yanino. And now, Chesene, Yabesan Atwan Commando so. Before you try Haba Nafi, Yasan Atwa Jumedis, Yenui, Akaka Krabi near the Abbey, and to train your basis.